Good day, everyone. Our topic for today's informative video is about somatic disorder. Somatic disorder, also known as somatoform disorder, involves having physical symptoms that aren't explained by known physical or mental disorder. So, in other words, symptoms that cannot be explained. Which means individuals aren't faking their symptoms. These symptoms are real, but sadly, it cannot be scientifically explained. Although the pathology of the disorder is unknown, researchers believe there are many factors including biological susceptibility, it's more common in women, exposure to emotional stress in childhood, and psychological factors such as learned ways of thinking in the context of a person's social environment. The main factors include childhood physical and sexual abuse, poor awareness of emotions or emotional development during childhood. This can be the result of such things as parental neglect or lack of emotional closeness. And lastly, excessive anxiety and attention to bodily processes and possible signs of illness. The first one is pain. This is the most commonly reported symptom. Areas of reported pain can include chest, arms, legs, joints, back, abdomen, and other areas. The second one is neurological symptoms such as headaches, movement disorders, weakness, dizziness, and fainting. Next is digestive symptoms such as abdominal pain or bowel problems, diarrhea, incontinence, and constipation. Lastly, sexual symptoms such as pain during sexual activity or painful periods. The first one that is under the somatic symptom disorder is pain disorder. These are the people that is suffering from chronic pain for which no physical cause can be found. Its clinical description are the following: pain in one or more areas, significant impairment, etiology may be physical and maintained by psychological factors.
Saan na masakit? Oo, parang mabiyak. Hindi ako makatayo. Anak, sabi ni Dr. Kim, wala ka namang sakit. Hindi ko nga alam. I'm not making this up. Sobrang sakit ang ulo ko. Anak, hindi na ako naniniwala sa'yo. Doktor na mismo nagsabi na wala kang sakit. Baka nasa isip mo lang yan.
Baka ante-ante mo lang yan, tulad ng mga sinusulat mo.
Bakit wala na naniniwala sa akin? Sobrang sakit na nararamdaman ko. Hindi ko na din alam. Ayoko na.
There are no exact solutions that will cure somatic symptom disorder. But to know that someone finally believes that I am not making up tales in my head alleviated the worry.
Hypochondriasis is a psychiatric disease. You can kind of think that doesn't exist in a sense that there's nothing wrong with the patient. So what the patient does is has this fear of having something wrong with them, like a serious disease or an illness that result and create many symptoms and complaints to the physician despite the fact that all of the tests are normal. So, what is hypochondriasis? Hypochondriasis is a chronic condition which, if left untreated, can impair an individual's physical fitness and mental faculties for life. It is hence strongly advised to consult with a doctor as soon as any typical indications of hypochondriasis are detected in a person to obtain pertinent treatment and ensure their complete recovery. So, what are the causes of hypochondriasis? The exact cause of hypochondriasis has not yet been determined. However, certain fundamental factors contribute towards the emergence of this health anomaly in people, which include beliefs and misconceptions, feeling restless and dissatisfied with simple explanation for usual symptoms. Some people look for evidence to prove a life-threatening disease is ailing their bodies. This, in turn, result in misunderstanding how the organs in the system functions and concluding that something is terribly wrong with their health. Hereditary influence is individuals who have parents or close family members with hypochondriasis have a greater likelihood of contracting the illness themselves. Next is the upsetting past incidents. Sometimes a grave disorder in the past that resulted in much pain and agony might give rise to irrational thoughts of developing a perilous health conditions once again. Underlying medical conditions. This is the chance of obtaining hypochondriasis is much higher in people who already have other psychiatric illnesses like depression, anxiety, obsessive compulsive disorder, to name um, obsessive compulsive disorder that causes symptoms and treatment.
Good day, everyone. So today we will be discussing about conversion disorder. When we say conversion disorder, it is also called functional neurological symptom disorder. It is a medical problem involving the function of the nervous system. Specifically, the brain and body's nerves are unable to send and receive signals properly. As a result of this communication problem, patients with conversion disorders may have difficulty moving their limbs or have problems with one or more of their senses. In the past, conversion disorder was thought to be an entirely psychological disorder where psychological problems get converted into physical symptoms. But today, conversion disorder is recognized as its own distinct disorder. Psychological issues, for example, trauma, personal conflicts, life stressors are often seen in patients with conversion disorder symptoms but are not always present in all patients. So, what are the signs and symptoms of conversion disorder? Conversion disorder is like many other disorders or diseases that have many causes, many risk factors, and a wide range of symptoms. Also, symptoms vary from person to person. The signs and symptoms of conversion disorder include loss of vision, double vision, sensitivity to light, limb weakness or paralysis, loss of voice, slurred or stuttered speech, trouble coordinating movements, memory issues or thinking problems, headaches, migraines, loss of sense of smell, chronic pain, loss of sense of touch, loss of hearing, numbness, tingling in limbs, body, or face, seizures, blackout, fainting, tremors, spasms, sleep problems, overactive bladder, and hallucinations. What are the treatments for conversion disorder? Since the symptoms of each patient with conversion disorder are different, treatments must be tailored to each individual patient. Doctors from many specialties can be involved in treatment. These include neurologists, physiotherapists, or help with movement symptoms such as muscle spasms, tremors and or weakness, psychiatrists or psychologists, physical and occupational therapists. Also ask your physician to further explain these tests. The more you understand about your condition, the greater the likelihood that treatment will be a success. Much of the focus of treatment is on retraining the brain. Since the nervous system is intact and the problem is in the signaling exchange between the brain and nerves, the goal of treatment is to relearn normal functions. Some of the more commonly recommended treatments include psychological therapy, such as cognitive behavioral therapy or CBT. And CBT involves learning about the disorder, recognizing triggers and symptoms, and learning new ways to respond and control them. Another is hypnosis, stress management training to make symptoms more manageable, physical therapy for weak limbs, walking problems, and other movement problems. Next is occupational therapy, speech therapy, and medications to treat the medical conditions that may coexist in patients affected with conversion disorder.
So for the symptoms of hypochondriasis is majority of hypochondriacs are preoccupied about their health and conclude they are sick owing to only ordinary body sensations like the stomach rumbling or minor sign of injury such as a skin rash. The distinguish of symptoms of hypochondriasis consists of fren- frenzied thoughts about being ill all the time, repeatedly scanning the body to check for any abnormalities, staying away from common places and well-known people due to a phobia of becoming unwell, alarm about procuring dangerous diseases like cancer or a heart attack, and lastly, skeptical about falling ill, either after numerous doctor's visits and medical tests all confirm optimal wellness or altogether refusing to consult with healthcare professional. So for you to treatments dependent treatments depends on identifying how deeply the patient is affected due to hypochondriasis and designing therapies to help them eventually overcome anxiety so they can lead a more productive life. Standard remedial procedures for hypochondriasis involve the cognitive behavioral therapy or the CBT. It is referred to as psychotherapy or talk therapy. Is aimed at allowing the patient to speak freely about their symptoms and gain insight into their illogical thinking so as to provide them with useful tips to alleviate anxiety and handle different situations with ease. Prescription medication. In addition to CBT, the doctors also prescribe antidepressant and anxiolytic drugs to the patient, which modulate neurotransmitter activity in the brain as well as uplift mood and enhance memory for their better functioning. For the lifestyle medication, basic practices such as following balanced diet, engaging in a daily physical exercise, as well as steering clear of habits like drinking and smoking, assisting in improving the overall health of the hypochondriac patient, thus guaranteeing the heal entirely. Remember that mental health is not a destination, but a process. It's about your drive, not where you're going. That's all. Thank you.
Body dysmorphic disorder or body dysmorphia is a mental health condition in which you can stop thinking about one or more perceived defects or flaws in your appearance, a flaw that appears minor or can't be seen by others. But you may feel so embarrassed, ashamed, or anxious that you may avoid many social situations. So, what are the signs and symptoms of body dysmorphic disorder? People with BDD focus to extreme on their looks. People find it hard to stop thinking about the parts of their looks they dislike. Focus on specific things, like a pimple on their skin, or the shape or looks of their nose, eyes, lips, ears, or hands. Second, feel upset about their looks. People with body dysmorphic disorder feel worried, stressed, and anxious about their looks almost all the time. Third, check or fix their looks. People feel the strong need to check their looks over and over. Like, for example, they check their looks in a mirror, ask others how they look, or they even fix their looks many times a day. Fourth, try not to be seen. Some people with BDD feel so bad about their looks they don't want to be seen. They may stay home, keep to themselves, or use makeup, hats, or clothes to cover up. Some people with BDD avoid looking in the mirrors because it is so stressful. And lastly, have a false image of their looks. People with BDD don't see their body as it really is, or as others see it. The flaws they focus on are things that others can hardly notice. They feel sure they look ugly, even though it's not true. How is body dysmorphic disorder treated? BDD can be treated with cognitive behavioral therapy or CBT. CBT is a type of talk therapy. It can help people with BDD learn that what they think affects how they feel. In CBT, people learn to notice their thoughts. They learn they can change the way they see their body. Slowly, with lots of support, in CBT, people learn to focus less on flaws. They learn to stop checking and fixing their looks. Second, medicine. Medicine that helps serotonin work well are used to treat BDD. These are sometimes called selective serotonin reuptake inhibitor or SSRI medicines. SSRI medicines can help people obsess less about their looks and feel less distress. With less distress, they can make more progress in the CBT. Adults younger than 30 will need to be carefully monitored when taking SSRIs as they may have a higher chance of developing suicidal thoughts or trying to hurt themselves in the early stages of treatment. CBT therapy and medicine are used together to treat someone with body dysmorphic disorder.